Now, here in Thunder Bay, we have myself, Julia,
Melissa, and Cassie.
Can you go to the next slide, please? So, as you can see, I'm the lead organizer and the program manager of our addiction mental health team here. Not in the room today is Mark, who was really our data collector and one of our addiction counselors. Cassie, who's here with us, is one of our intake workers. Melissa, who is also here with us, is one of our addiction counselors. And then Riley, who's not with us, is our addiction support worker. And in our project, we were taking a look at the way clients enter into our addiction programs. Next slide, please.
Alrighty, so Cassie here, we're going to do a little bit of a rotation for slides. So to start off with the patient/client story, our clients, community, and team recognized that there were barriers to entering addiction services at TBC. So when a client called to request services in January 2018, they had to wait 3 to 4 weeks to get into entry group 1, another week for entry 2, and about 10 days for their first individual appointment with a counselor. So the week between entry 1 and 2 was originally being used to assess motivation, which technically wasn't fair because if a client did show up for entry 1, then it does show that they are motivated. So altogether, a person would wait 5.5 weeks to meet with an individual addiction counselor. So this process was kind of meeting the agency needs and not so much the client needs. So then we decided to look at this process from a client perspective in order to make services more easily accessible, more trauma-informed, and more available when a client is ready to see an addiction counselor. So essentially, we were trying to switch our gears to meet the needs of the client, not the agency.
Next, oh, there you go.
So for our problem versus aim, our problem statement was that clients want to feel safe while accessing timely, client-centered treatment, which has not been available over the last 3 to 5 years due to a group entry model that prioritizes agency and administrative needs and high quantities of clients. This is evidenced in the 67% no-show rate from client service initiation call to intake to first of an individual counseling session in 2018. And then for our aim statement, our big dot aim is to increase client use of addiction programs at TBC. And then our E-QIP aim is that TBC addiction programs will increase the number of clients who attend their first individual counseling after entering service by 30% by July 2019, or an increase from 6 to 8 clients per week. Next slide, please. So this is the first draft of our project charter, which we did back in September. So our early problem statement was very simple, but it was unmeasurable. So Alex and Anna, thank you, helped us to refine it while continuing to capture the spirit of our original problem statement, which was clients wanting treatment now. Next slide.
Okay, Melissa here. So this is just a copy of the 5W2H worksheet. So this was the very first worksheet that we did together as a group, and it allowed us to take a step back and reflect on our own current problem, being that clients aren't able to access our program in a timely and caring way. This worksheet helped us to uncover key information about the problem area, and it allowed us to begin thinking of change ideas by asking why it's a problem, who it's impacted, and how it affects our clients. So from here, we had a baseline problem statement in which we refined throughout the process. Next slide, please. And then here is a picture of our fishbone diagram, which kind of further or allowed us to further understand our change ideas by categorizing certain areas of our entry group that may have been causing some issues. So like the purpose, process, resources, stuff like that. And then we brainstormed the causes by asking why. So why does this happen? Why is this a problem? And then again, allowing us to further enhance our ideas around change. Next slide, please.
Alrighty, so this is our Pareto chart. So essentially the data in here that we see, we use to capture who's not attending our entry groups and why. So originally intake had gathered data from 20 clients who did not attend entry group, but they called to rebook. So essentially we were asking them what kept them from making it to entry group the last time. So as you can kind of see from the chart, the reasons why clients didn't attend, it looks like 11 clients had identified life circumstance. So being sick, getting called into work, being out of town were some reasons. 4 clients identified ambivalence and discomfort and forgetfulness. And then 3 clients were accessing more intensive services. So they were either incarcerated or hospitalized. And then for the last one, 2 clients identified that substance use was kind of what kept them from coming in the door. So this information was super helpful. It helped us identify how we can kind of meet clients where they're at. So at first we kind of thought that it was out of our control, clients' lives, we can't really control what happens. But we did realize that a change idea would be to make services more accessible. So that's when we moved to more of a drop-in model for access purposes.
Next slide. Thank you. So here's one of our really early process maps, and this captures, believe it or not, what all of the steps that were involved with a client phoning to a client being seen by their first counselor. And I mean, you can't really see the detail, but you can tell that it's very intensive, and there's a lot of wait times in there when, you know, clients are just, they might not know what's going on behind the scenes, but they don't, they're not getting any access to service during those times. And if you go to the next slide as well, that's a little bit more of a refined version with the different people who are involved in all of the steps. And some of those little icons, of course, as you're all familiar with the process map, have to do with all the documentation that's needed. So we really took a look at everything we were asking of clients from the outset and whether that was conducive to clients wanting to actually come in and share information with us. Next slide, please. And then we took some of those and started plugging them in, getting a lot of change ideas from all these great diagnostic tools and all the really great material that we were completing through this E-QIP process. And we had a lot of help from Alex and Anna and Michael, sort of refining our aim statement and especially really figuring out, and this is something this is Julia speaking, I really struggled with figuring out how we're going to measure what we're doing so we can actually see when change happens. And out of everything that went on with E-QIP, I think the biggest learning piece for me was figuring out how to manage change when it's happening. Next slide, please.
So our root causes we found, the first one is the rigidity of the entry process. So in entry group 1, there was tons of paperwork. We found that a lot of it was maybe redundant information that the counselor could obtain through a one-to-one session. It wasn't client-centered. Entry 1 we found very dry, and it was hard to engage the clients when they knew that they were coming in strictly to do paperwork. The second root cause was the length of time and the number of steps in entry. So the length of time was at least 3 weeks from phone call to seeing a counselor. So if they were to call intake, they would wait probably about a week for entry group 1, wait another week for entry group 2, and that doesn't count for the clients who have other priorities outside of here, so work, so they would have to reschedule either entry group 1 or entry group 2 because it didn't fit in with their schedule. And then after entry group 2, they would wait at least another week or 2 to see an individual counselor. Number 3 was the time of entry. So we had entry group 1 on Mondays at 9, and then entry group 2 was also at 10 o'clock on Monday mornings. And then the fourth root cause is the staffing resources. So the staff availability due to them having other groups that they have to run, and even limited to the rooms that were available for the entry group. Next slide, please.
So we had the benefit of having a really long sort of baseline database to look at. And so this is like, entry E1 is entry one wait versus attendance. And so the red line up at the top is the number of days that a client had to wait before they could access entry group. And the orange line at the bottom was the number of people who attended. And if you go to the next slide, that's entry group 2, the wait versus attendance. And so as you can see, is between the first time they call, the number of days continues to go up as you move through the process that existed when we started. And then I think one more slide, please. I'll do this one. Okay. And so what we really found out by taking this like longer term look at all of our entry group data from 2018 was that the literature says that as wait times go down, attendance rates should go up. And that's just absolutely not what the data supported once we really took a deep dive into it, which was really fascinating for us because we thought, we bring down the wait time and then bada boom, bada bing, we'll have lots of clients coming to their sessions. And that's just not what's playing out here at Thunder Bay Counselling. The literature says that less than 10 days wait should be the highest attendance, but really for us, it's all over the place. The orange column on the left is a 10 or less day wait. And I believe the best attendance results we got from 2018 was when people waited 21 days. And really what we think that what we were capturing in that was the people who were the most motivated were willing to stick around for 21 days. And again, we just really reflected on how that's not fair for the client. All right, next slide. Unless you have anything to add. Okay.
All right, so this was draft 8 of our project charter. So essentially, we just continue to refine our problem and aim and our measurables. We did realize, though, that we had multiple aims, like increase clients attending, increase client retention, and decrease paperwork. So we had to simplify that. So we essentially simplified it to increase clients accessing addiction services at TBC was our goal. Mm-hmm. Next slide.
So we were able to move on to our first PDSA cycle starting just in the new year. We started, I think it was probably the first week after the
Christmas holidays.
Yeah, the winter break. Mm-hmm. And the first change that we made was taking that first and second entry group, reducing the paperwork and the content and making it really engaging and combining into single groups so clients no longer had to go through those 2 weeks. And our prediction around that was that by combining entry 1 and 2 and leaning the unnecessary paperwork and increasing the MI engagement in the group will increase attendance rates in the individual session. And as we started to analyze those results, there really wasn't a lot of pattern to the change emerging. We're still processing the data because what we find is that even when clients get to their individual counselor, sometimes, like we know, life gets in the way and they have to reschedule that initial appointment that they have. And so when we were sort of processing the data for this presentation over the last few weeks, we didn't have like firm data yet, but we started seeing some promising results. And what we determined was there wasn't a substantial enough change for us to just adopt it. So we wanted to adapt it. And the next change we were going to make, the second PDSA cycle, was going to be to change the time of day because we were still running entry group at Monday at 9 a.m. And we just kind of figured that most people who are experiencing substance use issues probably didn't want to be coming to a group at Monday at 9 a.m. But during this time, we were really encouraged by Anna and Alex to start doing an experience-based design questionnaire with the clients, and we actually started before Christmas to implement it. And as Anna and Alex know, it was a really good experience to do that and to be able to engage the clients in that way and to ask them about how they feel about each step in the process of coming to these groups. But everybody was just reporting that they were happy with most things all the time, and they were really satisfied with their service when they were getting in the door. And what I took from that as the lead was the clients are really happy to be here and they want service. So it's our sort of job and duty to give them fast, efficient access to that service because they're happy to be here. They want to be here. Okay, next slide, please. So then the second cycle, like I said, was that we moved it from Monday morning to Monday afternoon. Interestingly, we've implemented GAIN here, and we do a GAIN group that's on Monday afternoon. So all we did was swap them, and we were curious as a like secondary impact to see whether we would get different attendance results in our GAIN group. This was a much more recent change. This happened the week after Family Day weekend, so just mid-February, and we really don't have the data entirely around this, because again, we're trying to track we're tracking attendance, but we're also tracking how many people make it to that first individual session with their worker. And but again, the data we're noticing, we've had about a 10% increase of people making it to that first session, and so we're thinking that this is really promising. And so again, we were really hoping to raise it by about, I think 30% was our goal. And so we're choosing to, again, adapt this one more time. And the next PDSA cycle we're going to do, if you go to the next slide. Oh, pardon me. The next PDSA cycle that we're going to do with entry groups is move it to a Thursday. But I'm going to get into that for a minute, in just a minute, because we actually did a third PDSA cycle while the first two were going on. One of the people on our E-QIP team was doing an MSW project, and so he had this extra time on his own time to do a bunch of this legwork, and he actually ran a drop-in entry group model where people didn't have to go to the group anymore. A drop-in entry model where people didn't have to go to the group. They just got direct access to an individual counselor. And he saw tremendous results in the 13 weeks that he ran his individual entry pilot project, which is what we were calling it. He increased the attendance rates to about 78%, a 30% increase over the 2018 entry group model. So this was a really small scale implementation with one worker on a team of, I think, 14.
Yeah.
And so now we know that would be ideal. Everybody, we assume clients would want to come in and see somebody individually. We're working on whether we can implement that as a full program or not. So we started with that very small scale change. But as the E-QIP team alerted me to when I was talking about that sort of large program size change to individual drop-in and getting rid of the group, we had one more variable to check with the entry group model, and it's another small scale change. And so what they pointed out to me was when clients phone for service, when our groups are on Mondays, they have to wait a weekend to get in. And so what the team suggested to me was we move the entry group to Thursday afternoons. That way, if somebody phones Monday, Tuesday, Wednesday, or Thursday, they can access entry group the same week service. And so if you go to the next slide. Oh, sorry. We haven't implemented this yet. We're implementing it just after Easter, so you don't have a PDSA cycle on that yet.
There's no slide.
There's no slide for that one.
All right, so our outcome measures being the number of clients that attend the first individual session. Our process measures that we found were the number of clients attending the first individual session after the entry process, whether that being through their group or individual drop-in model that Mark was doing. The number of days between entry one and the individual session, and then our balancing measure was an increase in caseload, which may result in a decrease in staff availability, and an increase in wait time after entry one for individual sessions. Question, how will you be collecting the data? We're collecting the data from client attendance and enrollment records, which you'll see on the next slide, please. So this is a run chart that's showing the blue line is the number of individuals who were enrolled in the entry group after it was combined, and the red line is actually the numbers that attended. So you could see that there really is no pattern. There's no real trends that we saw. On the x-axis, where you see number 6, that's week 6, that's when we changed entry to the afternoon. So again, not really seeing any changes. The attendance rate still seems to be sporadic.
And what we were noticing was making these changes in January, the numbers could really be impacted by the terrible weather we've been having potentially.
Yeah.
I'm aware that we're running out of time and I don't want to keep people, and I'm hoping we can just skip forward a few slides. Can you please go to key overall changes? Because I want to talk really about some of the benefits we've gotten from E-QIP. So we found it a great, is this okay, Melissa?
Yeah, go ahead.
Yeah, great benefit to learn the tools and to analyze the data and really not to jump to conclusions. And Anna and Alex really encourage us not to jump to conclusions, even though we're really chomping at the bit to do that. we were putting a lot of pressure on ourselves to change faster, and E-QIP allowed us the time to really work through this. And next week, people are coming up and training us in the ideas training, and we're looking forward to implementing this across the team and across the agency as well. And then if you go to the next slide, can you just, maybe one more slide. Thank you. So in terms of what we would do next time, we'd start measuring earlier, we'd start acting sooner, we'd start recognizing the problems and changing things now that we have these tools to change things a lot earlier. And we're just really thankful that we were able to do this, and we're thankful for all the support we got from our coaches. So sorry we went on a little bit long.
Thank you.
Thank you very much.
Oh, some really great work there. It's Debbie speaking, and exciting to see all of your data. It's always lovely to see the information that you're tracking and the information that you have available now that perhaps you didn't have beforehand or in such a consolidated way. So I'm just wondering if there's any questions from anyone. Give me 1 second here. I'm getting some amazing work, and yeah, lovely to see your PDSA cycles and starting small and working from there. So we're really thinking it's not everyone understands PDSAs and doing them small tests of time. It was very interesting to hear about your one counselor who was doing something slightly different in the data that you got from there. So hoping that you might be able to be one of our people involved with the PDSA webinar down the road.
Sounds great. Thank you.
All right.